Hi, good afternoon, everybody. This is Carrigan Miller with Minne Inno. I'm watching everyone roll in, and I see some familiar faces. That's wonderful. Welcome to the State of Innovation Health Tech Meetup. We're really happy to have you here. So today we're talking with 4 startups in healthcare and health tech here in the Twin Cities. Each of these companies provide different services and solutions. There's a lot of variety here in terms of size, in terms of specific healthcare niche, but all of these companies have one thing in common. They've seen their business change because of the COVID-19 virus. Whether they're treating the pandemic as an obstacle or an opportunity, we'll discuss how they're running their businesses in unprecedented times and their outlook on what's to come. Now, before we dive into the conversation, for anyone unfamiliar with Minne Inno and what we do, Inno is part of a growing network of sites. We're currently in 14 markets, and we're committed to covering and connecting local technology, startups, growth, and innovation. We're really happy to have you here all today. We're launching a poll now. Is this your first Inno event? You can find the poll over in the webinar control panel. So okay, I don't know if you guys saw the results, but about 3/4 of you are in a Minne Inno event for the first time, which is really exciting. Thank you for being here. We hope you have a good time. You'll come back. So Minne Inno covers the local ecosystem via daily stories, a newsletter called The Beat twice a week, and events which are all virtual for now for obvious reasons. Check us out at minneinno.com to see what we're all about. And please sign up for The Beat, our newsletter. We have stories, job postings, events, and all sorts of things that we hope you'll find useful as you are running and working for startups and interacting in the ecosystem here. My job is to help the community and tell the stories of those innovating, thinking outside the box, and really impacting the ecosystem. So please reach out to me. My email is pretty easy to find at this point. It's in the Beat, it's on our website. So shoot me a note if you ever just want to chat, or if you have a story you think I'd be interested in. So now it's time to get down to business and learn about health tech. I'd like to thank our awesome panel for their time and being here today. They're all really generous for taking part in this. So I'd like to introduce our panel. First up, we have Genevieve Swenson, the co-founder and COO of Nice Healthcare.
All right, hi, thanks,
Hi,
Carrigan. Thanks for having me on here. I think I'm supposed to share a little bit of background. I am, as you mentioned, co-founder of Nice Healthcare. I work primarily as our Chief Operation Officer. I'm also a family nurse practitioner, so I have been working with and treating patients for over 9 years in that aspect. And Nice Healthcare has been open for 3 years plus now. We are a direct primary care clinic that brings virtual care and also in-home care to our patients.
All right. Thank you so much, Genevieve. Up next, we have Samir Kumar, the CEO of Habitaware. Hi, Samir.
Hey, how are you?
Good. Please tell us a little bit about yourself and your company.
Yeah, thanks for having me. My name is Samir Kumar. I'm CEO and co-founder of Habitaware. And Habitaware makes a wearable device that helps people manage certain compulsive behaviors that are a mental health condition called body-focused repetitive behaviors. So our device helps people take control of things like hair pulling, skin picking, and nail biting, which can be really destructive and are under-addressed and have a lot of stigma associated with them.
All right. Thank you so much, Samir. Up next, we have Catherine Murphy, who is the COO of Zipnosis. Hi, Catherine.
Hi there. Great to be here. Thanks for having us and representing Zypnosis. So Zypnosis is a private label telemedicine platform that powers the virtual care of over 50 health systems across the US. Our CEO, John Pierce, founded it in 2008 as a direct-to-consumer platform He often says that he was a decade too early with that approach. So we did shift in the around 2016 to go direct to health systems. And so we sell to health systems currently. We're best known for our asynchronous mode of care, which we call an intelligent interview. We also, of course, support video, phone, and chat. So really great to be here.
Thank you, Catherine. And last but certainly not least, we have Katrina Anderson, the CEO of Clinician Nexus.
Awesome. Thanks, Carrigan. Hi, everyone. I'm Katrina Anderson. Yeah, thanks for sharing my title. I always hate saying that about myself anyway. So we have a platform that helps medical, nursing, and allied health students find their clinical placements while also enabling health systems to be able to track those students as their future hires and future clinicians. So our main stakeholders involve health systems, the clinical programs that obviously are teaching these students, and then the students themselves. Thanks for this opportunity. I wish we could see everyone's faces, of course, but thanks for the opportunity.
Yeah, thank you all so much for being here. This is, for the people watching at home, this is a really cool crew. These are really cool people, and their companies are doing really interesting things. And so my first question is, I think, if I haven't talked to all of you about this at some point over the past months, then that's on me. But how much and in what ways has COVID-19 affected your business? Genevieve, would you like to start?
Sure, I would be happy to start. So interestingly, I think that COVID-19 actually didn't have an enormous impact on our core services. We were already set up, we were ready to go on virtual and chat visits, and that was already a large percentage of our visits anyway. What it did do, though, is it pushed us to push ourselves to really look and see how we could improve our offerings to our patients and our clients who are employer groups, as they were going through such a high anxiety, stressful time, new information coming in, not knowing what to do. And so we dug in and we went into kind of startup mode, as I like to call it, and really worked with our engagement team and helped to create programs for our the employer groups. We had a nice return to work so that they could use screenings and help the employees get back to work. We had our team go out and actually do some trainings on site, helping them learn to take temperatures, things like that. We also looked at what are ways that we can reduce the strain on the current healthcare system, the frontline workers that were dealing with COVID every day and trying to prepare their systems. And so we were able to work and find ways to get, little bits of PPE here and there so that we could keep our team going out and helping keep patients at home so that they weren't, ignoring really important issues that would then turn into a larger problem where they would have to go to the urgent care or emergency room and overwhelm the systems there. And then we also added a couple of new features that we thought were really, really helpful to keep people at home, but also well, again, so that, chronic issues, acute issues wouldn't turn into bigger problems downstream. Including in Minnesota, we do prescription deliveries, and we have free prescriptions as part of our plan. So we actually increased the number of the prescriptions that were available. We hired a fantastic driver to, go and deliver these to people's homes so they wouldn't even have to leave to go to the pharmacy. And then we also decided to add in physical therapy. So we worked with a really great company that's out of Minneapolis also, and they were just fantastic at virtual care so that they could still work with our patients with these issues, really important issues, and not even have to leave their home during this time. So it was challenging. I mean, we all were faced with the unknown. It was kind of scary at first, like, when do we go back out in the homes, when we do things like that? But we really took a go-get-'em approach and stuck with our patients and our employer groups.
That's awesome. Thank you so much for sharing, Genevieve. Katrina, how has the COVID-19 pandemic affected what you do?
Yes, so at the very beginning of the year, of course, you have plan A that you're executing on. And for us, we had just raised our 1.5 million seed round. So we had some big plans for the year. And then we learned in March that of course, as a lot of elective procedures were canceled, and in an effort to preserve PPE, students were just taken almost completely off of all units in hospitals. So for us, it was an opportunity, one, while our hospital partners were kind of reacting to this, to help build features that kind of just assisted in that. For example, pausing rotation information to make sure that students were able to believe and know they can come back and still have this experience kind of when things return to a safe position for students. And then also just scheduling things that kind of helped shuffle students around inside of health systems. So that was kind of a new piece we weren't necessarily planning on. We think it made our product a lot better and more efficient. But because the hospitals and then the clinical programs were kind of thinking, okay, we need to step back and create a plan for these clinical students and safe clinical learning environments, it provided an opportunity for us to spend a bit more time focusing on students that we work with. So the University of Minnesota students, as soon as they were taken off the floor, I loved it, just, replied and said, hey, we're just going to help those healthcare workers that we were just learning from and serve them by helping babysit and pet sit and run errands for them, just to do anything to be helpful while we're doing these virtual rotations. And so someone from our team was like, hey, can we just reach out and see if we can help? And we did, and we said, we just want to love on you guys. How can we help you? Because we were just feeling a bit helpless. And they're like, oh yeah, by the way, we're kind of like in need of some software to match all of this healthcare worker meeting students. And we were like, great. So we kind of just rallied together as a team over a weekend and ended up helping build a separate page where these students could simultaneously kind of help local healthcare workers, but then also be able to track that as volunteer experience for when they're applying for residency programs and other things. So we're not in the babysitting matching business necessarily, but it was a total privilege to help that, as the students did it as also kind of a COVID project. How could you also track and mitigate the spread by keeping students in pods in various areas? And so it provided us some unique opportunities to learn more about the lives of students and hang out with them a bit more than normal.
That's great. Catherine, we spoke a little bit what feels like many years ago, but I guess it was just a couple months ago, about how Zypnosis has kind of seen a boost from the pandemic. How is business now?
Yeah, I mean, I think when I spoke with you, it would have been early to mid-April. So we were right in the thick of things. And I think similar to what I'm hearing Genevieve and Katrina say, we were largely what our platform is meant to do. Was this was our opportunity to shine. No one could predict a pandemic, but the ability for us to immediately support our health systems with the asynchronous or intelligent interview mode of care was this scale approach that really helped triage so many and treat so many different patients. In fact, we saw over 1 million patients either screened or treated on our platform. We had a 3,600% increase between February and March. So our platform just sort of got completely inundated. And what was exciting is to see that it was fully prepared, the infrastructure and everything was fully prepared for this. What we did see was that health systems needed to quickly add staff to take care of those visits, but because of the scale and the efficiency, it was a matter of doing 1-hour trainings for groups of providers. And so literally a provider can be trained in an hour and feel comfortable using our platform. So even that was actually really, really exciting to see how quickly we could sort of ramp up and support our health systems in that way. Similarly with Katrina and Genevieve, there are things that we didn't realize we were going to be able to do, but it was all hands on deck, and it was responding on a daily basis to what we were hearing from our customers. We actually have a customer out in Washington State, and so they were kind of ground zero for everything that was happening. And so we were literally on the phone with them every single day, oftentimes 24/7, and made some adjustments to our protocol to basically stand up from a URI visit to a actual COVID visit. We also built out a COVID screener, and then we built out a COVID test fast pass. So we had already built a fast pass for strep and for flu, but we were able to do that for COVID as well. So that was really, it was just, pretty extraordinary to see how quickly the platform could adjust and how many changes could be made really, really quickly to affect the volume that we were seeing. I'm trying to think if there's anything else I would add. I think just the sentiment of all hands on deck and rapid change and really not overthinking what we were doing. We really just needed to respond to our customers and to make the changes and to respond. If it was working, great. If it wasn't working, making adjustments again. So yeah.
Great, thank you for sharing.
Yeah.
Samir, how have things been on your end?
Yeah, thanks, Carrigan. For us, the pandemic really affected people, our customers, and our community. The behaviors we help with are in part driven by anxiety, and those feelings were completely, exacerbated by the pandemic, as we all know. With people being cooped up at home, just everything that happened this year. And so what we tried to do was help that community and foster a stronger sense of community. So it was nice because we're already, a remote, pretty much, an online e-commerce company. But it allowed us to create webinars and connect individuals within the community and also have a stronger sense of connection with them. We typically offer one-on-one coaching sessions, and we saw a huge demand for those sessions skyrocket. And so for us, it was an opportunity to be there and support the community in a big time of need. And then the second thing was around, this idea of the pandemic, of not getting COVID by not touching your face. And a lot of people within the community started to use our device for that purpose. And it also, what it did was it allowed our body-focused repetitive behavior community to for other people to relate to BFRBs, to compulsive behaviors that you're not aware of. And so it helped a little bit in shattering that shame and stigma that we deal with, because now if everyone does it, everyone touches their face, a number of times an hour without really realizing it. And if someone tells you to stop, it's still just not that easy. And so we use that as a way to say, hey, this community is just like everyone else, just has a slightly different, behavior that happens that they need to get under control.
Sure. Yeah. I'd just like to draw the audience's attention to, we have a slot to ask questions over on the control panel. And at the end of this panel, we will get over to audience questions. So please, as these things come up, just ask, and at the end of the panel, we will get to those. Yeah, thank you guys all so much for sharing. One thing that I've been really interested in, because I find that everyone has a different answer to this, is what's a big lesson you've learned from this hard, unprecedented year? Catherine, would you like to go first?
Sure. I think the lessons and challenges were they obviously kind of go hand in hand, where it was really shocking to see our health system as it's structured be turned upside down. That they didn't want patients to come in to be seen because it wasn't safe for them, and healthcare providers were the ones that were really, really exposed, obviously doing their jobs every day. And then you've got this whole concept of where the revenue was coming in for health systems all of a sudden dried up overnight. And so that was an incredible journey to observe and go along with our health system customers. The other thing I would say that was an interesting challenge was at the same time all of this was happening, you had all of these non-compliant and low security level technologies emerging into the market to try to play a role and potentially take advantage of the situation. I'm not saying that was the case for all of the solutions, but I liken it to meaningful use. So 10 years ago, meaningful use had the intent of encouraging the adoption of electronic medical record systems. Well, what happened was the unintentional consequence of all of these EMR solutions hitting the market, and they weren't all really good solutions. And so it's interesting to see the challenge of our times and the challenge of COVID, having all of these things sort of pop up from that perspective, and then at the same time seeing how health systems are responding to that. And what's really promising from where Zypnosis sits is that consumers actually were really ready to take on and to accept virtual care. So those are one of the, on the challenging side, things got flipped upside down. On the other side, we've got forced innovation in some areas and solutions that were ready to shine, like virtual care. And then you've got a consumer base that went from, the early adopters using it, the relatively healthy people using it, a small percentage of people, to all of a sudden everyone is using it. Everyone has become very comfortable with it. And now we're seeing the proliferation of other use cases. So Carrigan, I don't know if that answered your question super well, but there was a little stream of consciousness from that.
No, definitely. Where, even the biggest fans of healthcare will readily admit that this industry moves really slowly. Where even the best technology will take years to adapt. Katrina, what have you learned? What have you seen?
Yeah, I would just agree with everything that Catherine just said. I think it was really fun to watch Zypnosis shine because there was so much effort that you guys had put in for the last 10 years. And it was encouraging for me to watch because I've always been, we're years behind Zypnosis. And so to have that opportunity for you guys happen was just an exciting thing, I think, for our community. I think the lesson out of that too for us is that timing is important, and listening to what our health system needs is also very important. Because in our instance, I think there was this frustration. I think I recall when my husband had Hodgkin's lymphoma, there was a bit of this, you're watching him ache and you can't do anything about it, and you feel helpless. And that is such a frustrating emotion to feel when you're like, I don't have the skills, I don't have the ability, and you want to be helpful, but you can't. And I think that I'd imagine the majority of us just kind of felt like I've lost all control because of this pandemic on every possible front. And so I just want to be helpful. And so again, yeah, that good intention was behind so much of that. But there's kind of a wisdom, I think, gained in just stepping back and saying, okay, the hospitals that we serve needed two things primarily right now. It was to get prepared for this to continue, and to get their systems prepared for virtual care and for remote work for their employees. And until those things are done, nothing else can be kind of considered. And I think just taking the time to be like, okay, great, let's take a step back and listen and think about how our solution does play into this. Because it's easy to all of a sudden assume, oh, this happens overnight and this big success is, how exciting. And again, you're like, no, you watch Zypnosis just fight and work on it for years and years. And so again, it's a gift, and being able to stay connected as a community to know those stories with your organization, I think is what helps us all kind of stay aware of the effort that is required in order to make really big changes for our healthcare ecosystem. So that was one thing. I think it provided for us personally an opportunity to reflect on our messaging. It was our thesis is that until we help hospitals figure out their ability or their capacity to actually keep taking on new students, that programs can't increase enrollment, and then we can't have more clinicians, nor can we really monitor at scale the value or the kind of quality of clinicians coming out of various programs. And so for us, this was a cool opportunity to shift some of that messaging and say, wow, this was a prime example of when students were taken off the floor. Now we're going to be potentially perpetually behind in supplying new clinicians that we're kind of relying on, as this is only going to burn people out. So I think another big lesson is that we have to have a greater emphasis on our healthcare providers' well-beings as well, because if they're not well, then we all kind of fall apart. And so I'm personally delighted for our healthcare providers to hopefully get more solutions that emphasize their well-being, because I think we've run them pretty hard for a long time. That's my personal opinion. So.
Sure. And Katrina, I'm sure you know more about this than I do. We're approaching an impending clinician shortage by the end of this decade, right?
Yeah. Yeah.
How serious is that?
Well, yeah, it always depends on who you ask. If the shortage is, I think, more terrifying if it's not necessarily about volume, but quality of having quality clinicians. A shortage of that is, I think, of greatest concern. So there has to be some sort of emphasis on how do you ensure a clear pathway for you as a future clinician to know exactly what it looks like to become competent and confident at the bedside. Those are very important pieces that have to be combined together. And without an attention to detail on that, we're just at risk for a lot of programs opening, but not necessarily being held accountable to giving us the appropriate kind of quality, if you will. And it's really amazing. I think it's maybe not as well known just how much of that teaching and that passing on of that knowledge comes from clinicians that are on the floor treating patients presently. And so there's kind of you can't have one without the other. You have to give attention to those clinicians that educate and those that are entering the workforce. But they're projecting significant shortages by 2024 prior to COVID. And this is medical schools have seen their highest volumes of applications just because people want to help in years. So it's wow. It's time that way. Yeah.
Sure. All right. Well, thank you.
I'll stop.
Samir, what have you learned? I mean, they say hard times breed resilient startups. What have you learned?
Yeah. I like to think that I like to think we were resilient before the pandemic, but certainly the pandemic took that to a new level. I feel like, mainly it was just challenging in managing the new way of operating. We have a physical product, we have an office. My wife and I are two of the four co-founders. We have young kids, and so just as it was for everyone, it was just challenging, and every day was the same, and we were just fighting for hours to figure out who needs to get what done and what can slide. So there was that aspect of it. But then for us, the biggest lesson, I think, for the business was really to actually stay the course. And even in uncertain times of uncertainty, there's a lot of things that we could have done or could have pursued. The face touching example comes to mind. And, we literally had, I think, people telling us every day and sometimes multiple times a day in March and April, you should adapt it and market it for face touching. And we could have kind of changed the app or made a different version, which would have taken not too long, but maybe a month or 3 to 6 weeks of dev time for our lean team. It was a lot to actually make that decision and say, should we or should we not? And so what we decided to do was to test it and see if even though it seemed like a kind of a good idea, do people actually want this solution? We weren't really sure. Do people actually want to buy a device to help stop touching their face because that may help them not get COVID? And although it seems so appealing for a company like ours, it turned out to not be really the right solution. the right question was really how do I avoid COVID? And with people in lockdowns and people and sanitizer and all of that, that's a much better and more effective way, and social distancing to actually avoid getting COVID, rather than trying to learn how to stop touching your face and getting a device for that, for this problem that is not really a problem for you until it happens, and it could happen for any number of reasons. So, so we tested the existing product as is, running tests, and determined that although it had some mild traction, it wasn't really the right solution and worth taking our team off track for a month or so. And so for that, and really we just doubled down on focusing on our community. And so that was our lesson.
Like when you're driving on a slippery road, the worst thing you can do is just crank the wheel.
Yeah, I mean, it's so appealing to do that, right? But you sometimes you don't want to do that.
Genevieve, what have you learned at NICE? I mean, do you have any sort of better clinical understanding? Is there?
I mean, I think that as a clinical team, we really had to come together. And I mean, I always felt like we were pretty good at communication. I mean, we're a techie company, like we have quick communications, but even with that, our team realized like how consistent and how quickly we have to communicate. I mean, when things were coming in about COVID, it seemed like it was different sometimes within 12 hours than it had been, the day before. And so how do you have, a staff of 23 clinicians, and how they page, how do we communicate the same information, care for our patients consistently, and also try to help them. Like there's a lot of mental health concerns that would come in through this, and there was just so much fear, and for us to look afraid at the same time would have probably been the worst thing we could have done. I mean, it doesn't mean that we didn't take it very seriously and have a lot of our own concerns, but to really let our patients know that we were there for them. And I think, and I resonate so much with what you've all said so far. And I think like one of the biggest lessons that I've learned that I'll kind of turn towards, entrepreneurs or those of you that are running businesses, is that it's just so important to build your business in a way, or start building your business in a way, and surround yourself with people who are able to be nimble and flexible. Like, I think we all know how easy it could have been to just kind of crumble under the weight of the unknown and the stress of this situation. I think we've all had things in our lives that have come in and, they've been traumatic, but for a whole society, we were shown that nothing in life is guaranteed to be the same tomorrow as it is today. And so to apply that to your companies, I really think the best companies are those that are able to pivot when needed and do it quickly and efficiently. But as Samir said, also stay true to the course, and I know Zypnosis, like you had your async visits, and now you really put them in the limelight. Samir, you're able to stick with what you are doing, but also, consider like, could this help in other ways? And I think NICE Healthcare really did that too. I mean, we stayed true to primary care. We didn't close our primary care. A lot of clinics, they just didn't have a choice. Or they weren't ready, they weren't prepared for something like this, and they did have to close. So you had millions of people that weren't getting the primary care that they needed, and we felt really proud to be able to contribute to our communities, and hopefully that continues to grow over time. We can bring primary care to everybody, because that's really where it all starts.
That's great. Well, thank you so much, Genevieve. Shifting away from COVID a little bit, and hopefully to something a little bit more positive, a little bit more uplifting. Last week, Medical Alley Association reported that Minnesota's healthcare startups have raised over $1 billion this year. Are you seeing an increased interest in healthcare startups in this state? Is the ecosystem healthier noticeably to you? Samir, would you like to go first?
Yeah, sure. I think that one thing is clear, that there's just 2020 has just accelerated the trends that we've been seeing in digital health, in all things technology, which were moving forward already, obviously, but now a lot of those companies that were on a strong start just saw everything move faster. And I think investors are following that trend as they have been. But yes, I do think it's here to stay, and I think it's the beginning of a longer, a 5, 10, 15, 20-year movement.
Wow, Katrina, what do you think?
I agree with Samir. On the whole, I think that just from our own experience, we were put on lead lists, you could tell, for a number of VCs, and they were outreaching to us cold a lot earlier this year. We weren't raising around this year, but I think that's also, VCs are getting a bit more intelligent business operations themselves for sourcing, and they're kind of being pushed by the community to reach out and think differently about their sourcing for their portfolio companies. So that was an interesting thing to observe this year, and I appreciate it because it positions founders also to be change makers and not, people that need capital. It's people that need capital to make change. And so it kind of seems like a lot of VCs are reaching out to be partners to companies, and that's an encouraging thing. I think as long as we all stay the course on solving real problems, then the money will always come back to the Twin Cities. So I think that's something that hard work is not anything that we're afraid of here in the Midwest. So as long as we kind of do all the things that we were just saying earlier, staying focused on building really good, sustainable businesses that solve real problems, then it would just be inevitable that capital would keep flowing this way.
Sure. Genevieve, Nice Healthcare is proudly bootstrapped, but is increased attention on the ecosystem a good thing? Are you noticing increased attention? Do you have more clout?
Yeah, I mean, I think that to go off of what Katrina said, actually, I've had more investors reach out even to me. Like typically they would, go to our CEO, but reaching out, just trying to get introductions. And,
Wow.
I think that the pandemic has really pushed healthcare and the idea of healthcare innovation, and innovative companies, to the forefront of investors' minds. So I do think that more VC capital will go into healthcare as healthcare costs continue to really cripple our economy. It's hurting businesses, it's hurting employees, on a really personal level. And also, I feel like the pandemic has affected the younger generation like no other healthcare issue in their life so far. So I do believe that it's going to push them to also take a bigger interest in their health and healthcare policy, which, in turn, all of that should make investors a lot more interested, even if they maybe haven't kind of delved into the healthcare space before.
Sure. I hadn't thought about it that way.
Yeah.
Catherine, at Zipnosis, are you seeing your boat rise with the tide, so to speak?
Yeah, I think one of the things that we have noticed, and this is something, again, that we are so happy to see, is that our initial foray into health systems is urgent care. And so what we're seeing is that we've been pushing this for some time, but the concept of you can use a virtual care platform beyond just urgent care conditions. This is a tool that is useful across multiple specialty lines. Behavioral health is one. Primary care is another, oncology and pre and post-op. So what we're seeing is the expansion and the interest and the very, very rapid adoption of deploying more virtual care across these other specialty lines. And so that's one of the things that I am really, really excited about, is not just, obviously there's a ton of market interest and we're seeing tons of activity. 98.6 had a massive raise a couple days ago. Teladoc purchased Livongo, so there's a lot of really interesting things happening. But just on a more sort of local level within Zypnosis, we're really excited to see that the expansion is happening within our own health systems and deploying virtual care for a far number of other use cases beyond urgent care.
All right, great, that's awesome. And this is going to be a very open-ended question, so People get annoyed with these sometimes, but I'm going to ask it anyway. You as health tech people are kind of at the cutting edge of healthcare. You have a fair hand in determining where our systems go next. What trends are you looking out for, aware of, excited about in healthcare and health tech and healthcare startups? Katrina, would you like to go first?
Sure. Mine will maybe be of no surprise that it will be a greater emphasis on our healthcare workers. I'm personally very passionate about that. I think being able to kind of see what happens in terms of after the pandemic, focusing on mental health is probably going to become a really even more important thing after. That will be the next pandemic after this kind of wave of COVID, and we have a vaccine, I'm sure. And so part of that is just going to be well-being of the people that deliver the care that we need, and that becomes the kind of transaction, unfortunately, of what happens in healthcare. So I think there will be a greater emphasis on that. I hope it's humanizing. That's my preference. I say that as a patient who's living with my husband, who has a physician made decisions on his behalf for his healthcare, and they were not great decisions. And I think about when I make decisions as a business owner that maybe don't always have the best outcomes that I want personally, it breaks my heart. And so I can only imagine the weight of being a clinician and just not knowing, or all these different decision-making points. And so I'm really hopeful that there's a greater emphasis on decision-making as well as just humanizing clinicians and creating great space for us to just be human together.
Sure, that's awesome. Thank you. Genevieve, what's on the horizon? What are you, if you were a betting woman, where's your money going?
Oh, well, I know where I really hope it goes. I really hope that healthcare continues. It really hasn't been doing it that well, but I really hope that healthcare can look at the core of where everything kind of comes from, which is back to primary care. Like, our company is really big on saying that we believe that everybody should have access to quality primary care. You should have multiple touch points with a provider you can trust every year, not just over many years. And you shouldn't have to worry about the cost behind that. The neglect of offering or having primary care has led to so many other issues downstream. At Nice Healthcare, we have a less than 4-minute response time for a patient if they have a question to get a hold of a provider. Less than 4 minutes. Yeah. So it's it's quite incredible. And we just say, I don't know why this, and it doesn't even have to just be Nice. I mean, of course it doesn't have to just be us, but why is this not offered everywhere? Why do we not care about our citizens, our patients, everybody we know having amazing care and being able to access it as often as they need? And I think that goes to what you're saying, Katrina, about mental health. I mean, there needs to be easy access to these sort of things, or we see so many other problems down the road. And there's so many of our national costs that could go away if we actually took care of everybody from the day they were born, without this fear of cost. And so I'm hoping that with all of these new innovative companies coming out, that we will be able to find different ways, more affordable ways to have access to primary care for everybody. And that may or may not include insurances, but we need to be looking at these other opportunities as well, and not just, as soon as this pandemic's over, let's not go back to the status quo. Like, there are things in our face right now that we know that we can work on and improve. And I don't know if my bet will come true, but I hope that enough people have kind of, woken up to some of the problems and are willing to step forward and try to change the way healthcare is being delivered.
Sure. Samir, with this talk of mental health, what do you see on the horizon? Especially with regards to behavioral health and mental health.
Yeah, echoing Katrina and Genevieve, mental health, I think deservedly so, was put in the spotlight over the last 6 months. And, it's something that I think we can no longer ignore. And I know we've been saying that for years, but I think this pandemic put a finer point on it. I also think that just with the shift in everyone being more comfortable with telehealth appointments, with remote monitoring, I just see that as being helped, that trend being helped so much by the last 6 months, because the resistance to it, which was insurers and doctors being willing to change their ways and adapt to a patient who wants a tele appointment, and an insurer actually paying for that, those barriers have been broken down, hopefully not temporarily. And so, from a purely myopic, what I see is, 24/7 continuous care aided by remote devices, monitoring devices, where the doctor can get updates on their patients as they need to, whenever they, at all times it's there for them to access and proactively schedule those appointments or provide an intervention.
Sure. Catherine, I mean, I don't want to steer you towards telehealth, but obviously it's been at the front of everyone's mind. We're starting to see, at least from local organizations, that there's interest in keeping it around. Here's the two-parter, how will telehealth change over the next 5-year horizon? And is there anything else that you're keeping an eye
on? Those are big questions. I think we're seeing it change, maybe not as quickly as the pandemic, the daily and weekly changes, but I think we're going to see, if we stop today and look back in a year's time, I think we're going to see an extraordinary change in how patients will continue to access care and how providers use this as an ongoing tool. It does not replace in-person care. It does not replace anything structurally. What it does is add a tool for providers to support their patients. And so I think the biggest thing is consumers are going to be taking more and more of a driver's seat in healthcare. And so, we are hearing from our health system customers that they want to make adjustments to have things be more on demand. So in other words, putting it in the hands of the consumer to decide, I want to do a depression screen, or I want to do an anxiety screen. So put it in the hands of the consumer to decide that they want to take that step. And then follow that up with putting it in the hands of the consumer to decide, I want to schedule a visit with a provider via video or do an asynchronous visit. So providing a broader array of visits that the consumer can decide, and they can schedule it and they can get started, and they can either, decide to do it via intelligent interview or via chat or phone or video. But I think that's really the trend that we're going to see continue to drive. And we certainly see health systems asking for more of that technology because they are adjusting their digital health strategy to meet that need. And yeah, so I would say that's the biggest thing. I don't know if that's a huge change, but I think we're going to see the acceleration of that demand happening faster.
Sure. I must say, it's between talking to you folks and talking to health systems, you guys have a much more optimistic perspective a lot of the time. All right, so now we are going to audience questions. This first one is from Jonathan Daniel, who says, thanks for a great panel. It's fantastic to hear that you guys are doing well. A question for any and all. As you grow in response to demand in the US, are you also seeing demand from abroad? Does international growth seem feasible to you at the moment? If so, what markets are interesting? Catherine, would you like to start?
I may not have as much of an interesting answer as my other panelists because healthcare obviously is very local, and so we depend on those ICD-10 codes and that sort of thing. So the concept of bringing virtual care, of course, it's going to be international, but I think there's some limitations there as far as just taking the template and applying it to a different country. So, but sure. I think And in large cases, we do have national run health systems that are already deploying some of these tools. I can't comment on their how efficient they are, but I think a lot of countries are already doing some of the things that we're stumbling across today in the US.
Sure. Samir, have you any interest outside of the US?
Yeah, we've always been shipping, across the globe. We've shipped to, more than 70 countries, our products. So, but our focus really is, for now in the US until, and the only limitations really are kind of just resourcing and staffing up and making language changes, that kind of thing. But it does take work, and it takes effort to build up a brand internationally if you're a consumer electronic, as we are. So the nice thing is that we've just seen more of that organic demand without us really doing too much or making dedicated efforts internationally. And so we've also enabled a distribution partnership this year in the EU, in addition to our Japan and Australia distributors. And so where we have niches, we're seeing them, or folks who already have a market in or a connection to the BFRB community, we're seeing them actually continue to do well, and hopefully we can continue to support them.
Sure. Genevieve, is there any plans to?
Not at this point. I think that, well, right now our focus is on expanding throughout the Midwest and certain other states in the Southwest. But I think the model itself could really work anywhere. We always kind of joke internally when we say, people will say, oh, hey, are you going to Uber today? Like someday people are going to say, hey, are you going to Nice today? It could work anywhere. But as of right now, we aren't talking about going international.
Sure. Katrina, any thoughts, plans?
Yeah. We always say that clinical education is like spaghetti, because you can just grab in, and you can't just grab one noodle, you grab a bunch. And so if, for example, a single hospital might be affiliated with 100+ clinical programs across the country or globe. So we've had national students on our platform kind of from day one, just by nature of that. But in terms of actually securing health systems or clinical programs as our kind of next step in this, that's what I think a Series A or B might be for a bit more, because it would be a fairly significant lift for us. One of our biggest competitors is in India. So in terms of can we scale, the question or the answer is yes. And it's for us just a matter of when is the right time, based on kind of the current situation. I think when and no international students are, of course, traveling for clinical learning experiences. So I think international growth will be strategically postponed until travel is back to normal. But.
Sure. I have that metaphor stuck in my head now. It's so visual of grabbing spaghetti.
Yeah, it's fun.
I love a visual metaphor. Okay. A question from Andrew McGee. Andrew asks, now that we are 7+ months into COVID, you have had the chance to react and adjust to the changes as a result of the pandemic. How do you see yourselves scaling from here? Beyond capital, what is required for you to make that scaling possible? Samir, would you like to go first?
Sure. For us, the pandemic didn't really, as I mentioned, didn't really change our focus in terms of, our vision and what we're trying to execute on. But really, what we're focused right now on is imminently the launch of our next gen product, Keen 2, which is which we believe, we liken it to if Keen 1, our first product, is a tool in the toolkit to take control over these behaviors, Keen 2 and the app and all the support you get is now really the full toolkit, where we're helping you go beyond just the awareness piece, but also figuring out how to replace it and getting smart on the back end. And so that's what we're really focused on now. And then using that platform, the new platform of Keen 2 and the app and the back end, to begin to adapt to additional needs. And so we're really focused on specific solutions for meaningful conditions. And our first meaningful condition is really just body-focused repetitive behaviors. So we're continuing to do that, and hopefully with the launch of Keen 2, 2021 will be will allow us to kind of make good on that promise.
Sure. Genevieve, would you like to, I guess, first, could you tell the audience a little bit about how NICE is already scaled already, right? Where it used to just be available in the Twin Cities metro, and now it's the Twin Cities area for you has gotten much larger, and it's also in other metros. So can you talk a little bit about that, and then a bit about what's next?
Right, yeah. So, I mean, we really started NICE and focused on, kind of the metro area that we knew. Like we had a good sales partner kind of lined up. We knew the geography, and then the next year it was like, hey, let's just go all the way from the metro down to Rochester and to Mankato and over to St. Cloud, and really encompass a huge portion of Minnesota's population, and just kind of see what that looks like. And then this year, we added multiple states. We added Wisconsin and Arizona and Utah and Nebraska, and just, kind of, we ended up finding what we think is kind of our perfect formula. And I don't know that I, give all of the details of the formula, but a lot of it is very data driven. It comes down to population density. It comes down to like the geographical area and how convenient it is to do home visits. And then one of the big pieces, though, is the state regulations themselves. Being a direct primary care clinic, we can't operate the same in every state across the board. So one thing that we're really hopeful for is during the pandemic, and not to always bring up the pandemic, but that's kind of what we're talking about here too. There has been some different, some changes made through the CARES Act, and licensing has become a little easier for the time being, and they've reduced some of the restrictions on DPC. We're hoping that as a society, I guess, we will see the value in making access to care easier, more affordable, more convenient. So can some of these changes stay? And that's what makes it so much easier for us to replicate, and go to every different market, where people want us to go, we can go and do that. So right now, where I think we could go in all 50 states. It's just, it really changes the makeup of, who you can hire, how much it costs to do that, like how can you label your company? And so anytime that you add more costs on, eventually that has to somehow translate back to increasing your price, which is the opposite of what we want to do. I mean, we work on an ethical margin. That's what we call it. We charge as little as we possibly can to make this work so that our patients can actually use us and the employers can afford to add us.
Sure. Katrina, how are you going to scale in the future?
Well, I love this question because we had the blessing and a curse event. Our second customer was the largest for-profit health system in the country. So we scaled in year 2, and my co-founder said we were fishing with a kiddie pole and caught a whale from an operational perspective. And so 2018 for us was really figuring out a lot of those kinks. And actually this year we're excited to be working with a few of our local health systems to think more strategically about the regional experience of a clinical learner, as they might go across the street to 5 different clinics in a single year, and they have varying experiences at all those sites because they're in different systems. So it's a privilege to work locally, so that now that we kind of have this national scale, we can kind of do what Genevieve was saying, kind of create that best practice that can be copy and pasted in a more saturated region where nursing students are pretty easily hanging out in the same area. So
sure.
So much more I could talk for.
I wish we had more time. Catherine, what's next for Zypnosis?
Well, I would say obviously what we do know from the pandemic is that there is not going to be an off switch. I think there'll be sort of a dimmer switch of sorts, and then we're gonna find our way to how everyone operates I don't necessarily like the new normal, but whatever normal will be looking like as we move ahead. So I think what that means for us is on the one hand, it's really good news because our platform is scalable, not just from being able to see the number of patients that we do and minimize the clinical work time with zero documentation. But I think we're going to continue to see, as I mentioned before, the expansion across other service lines. I think what that's going to require is for more optimization of our existing products. And so I think we're going to see more demand for things like our lab fast pass being applied beyond just COVID to other use cases as well. And so any number of tests, or whether that be antibody at home tests, you know, people that are actually feeling okay but want to take a preemptive test. So I think we're going to see a ton of optimization around the same products that we have and improving them. And of course, on the back end of that, that requires further integration with the EMR that resides within the health system, or I'll just say with the medical record. So we want to continue to push to make sure that data is available to the patient so that they have a complete set of information, and that there isn't a clunky handoff between the virtual care technologies and the sort of resident medical record technology. So we'll be continuing to push for and develop more integration with EMR. And then on the regulatory side, I think I'm actually really encouraged to see what has happened. So I think we're going to see, obviously, not everything will stay as far as the lifts that we've seen, but I think we're going to see a lot of the changes that have taken place. I think we will see those change. And then on top of that, I think we're going to continue to see improvement as far as reimbursement parity. So I think that that's going to be a really, really good thing. And I hope we'll continue to build momentum there.
Okay. Well, everyone, thank you so much for your time. I really appreciate it. This has been an awesome panel. Thank you for bringing your knowledge and your charisma to the panel.
Thank you. I learned a lot.
Thank you.
Thank you.
Yeah.
All right.
My pleasure.
Have a great day, everybody.
Bye-bye.
Thanks.
Bye.